there are three parties. Party number one is the individual, the patient, or any person who is using these injection. Party number two is the doctor who is prescribing it. The party number three is the retailer, the pharmacy who is dispensing this medication. So let's understand the responsibilities and do's and don'ts of all the three parties. So first, I will come to the responsibility of the doctor. So when a doctor is prescribing Ozempic or Mounjaro, what a doctor should ideally see in the patient. So question number one, the doctor has to ask to himself or herself, is the patient eligible for these medication like any other medicines? Is it justified to write or to prescribe Mounjaro and Ozempic to a particular patient? The answer is very clear, and I'm again restricting myself to non-diabetic, obese people or overweight people. So if a patient is overweight, let's keep it very simple. If the patient is overweight, patient is eligible for the prescription of Ozempic or Mounjaro. Then comes the question, what doctor has to ask whether the patient is fit to take these injection. Are there any contraindication in that patient, whether to whether to really give these prescribe these injections like Mounjaro or Ozempic? And for that, doctor has to perform these clinical evaluation and the lab evaluation. And in that, the most important comes are the serum amylase and lipase. So the pancreatic enzymes is something what doctor has to every doctor has to see before prescribing Mounjaro or Ozempic. And if the amylase lipase are high, then that patient at that particular point of time is not fit for Ozempic or Mounjaro. Then comes uh, any history of gallstones which is not being treated surgically. Those candidates should also be ideally should not be kept under the basket of the prescription of Mounjaro and Ozempic. Then if there is a history of any malignancy, and here I will not restrict to only thyroid malignancy, any malignant history we should be very careful. And in current point of time, I would rather say that we should stay away from prescribing Mounjaro and Ozempic, because we don't have much of the data about the safety of these injections in this group of patients, and we have to wait for few more years to see to have those data collated and then have the final inference of that. Other than that, the people who are not motivated enough to follow the dietary restrictions, what the doctor tell them, those people should not be given Mounjaro and Ozempic. And in that, very important is the patient should not be consuming alcohol during or even after the regime of Mounjaro and Ozempic is over. When this question comes, and a lot of people ask whether we can take the alcohol after we reach to our target weight loss or something, then the answer should be, once you have stopped alcohol, it is better to stop alcohol forever. Why to reintroduce it back? And then why the people should be away from alcohol while being on Mounjaro, while being on these injection Mounjaro and Ozempic? The answer is very clear. Very clear. It's not only about Mounjaro and Ozempic. It's about any modality of weight management anybody is doing. At that particular point of time, we have to understand that there is a lot of load during this whole process of weight management on the pancreas itself and on liver and on kidneys. And then at that point of time, we don't want to add up any extra burden or any extra insult to these organs. And for that, it is very, very important then that the doctor tells the patient to stay away from any sort of addictions, including smoking and alcohol. You can always ask your patient to choose between the two, either these injections or alcohol. And actually, now Mounjaro and Ozempic, these drugs are going to be tested for even making people to withdraw alcohol. So they will very soon get the approval for assistance in alcohol or smoking cessation, and that would be something very good. So these are the things. And then what further needs to be done by the doctor is the ultrasound of the abdomen pelvis to see the status of the pancreas. Is the pancreas inflamed, or is too much of fatty infiltration in the pancreas, or and the gallbladder? If there is a gallstone or if there is any sludge in the gallbladder, we should be very careful while prescribing these medication. And out of, like, I have witnessed one patient who had the like, who had developed actually the biliary stasis and then a huge gallbladder, gangrenous gallbladder, which had to be removed actually. Then the cholecystectomy had to be done. So we have to be very clear about that, that before starting these medications, the gallbladder should be hale and hearty, not having any gallstone or any sludge in that. Other than that, we need to do the ultrasound of the thyroid, and because there is a lot of talk about it, the medullary carcinoma of thyroid, family history of medullary carcinoma thyroid. Not many people even know about whether they have any family such family history. So we have to be careful and do that. And if there is any nodule in the thyroid which is hypoechoic and which is more than 1 centimeter, it is always better that we should stay away from prescribing these medications till we have clear data and literature about the safety of Ozempic Mounjaro in such patients. In any way, any patient who is presenting with with hypoechoic nodule in the thyroid gland, which is more than 1 centimeter, we have to evaluate it further for any malignancy. Otherwise, also. Other than that, because there has been a lot of hue and cry in the population about the retinopathy caused by these medications, which still have to be proven, which still have to be proved. But yes, to be on the safer side, it is better to get the eye checkup of the patient done, because in diabetic people, in any way, the annual eye checkups are done, and so we have a document of whether there is a pre-existing retinopathy or not. But in non-diabetic people, usually they don't do their eye checkup very regularly. So better to ask them to get their eye checkup done and to document it. Then the question is whether in retinopathy, whether we should give these medications or not. The answer is not very, very clear. But once there is a retinopathy, I don't see any harm or anything worse going on. If retinopathy is already there, by giving these medications, if we can help the patient otherwise in losing weight. So these are the prerequisites what need to be done. Along with that, if because if there is not too much of test and investigations happening, is not too much of burden to the patient, then we should do a sleep study to rule out the OSA, the obstructive sleep apnea. In any way, every overweight individual should do the sleep study. And if there is sleep apnea, definitely CPAP should be advised along with these medications. And one more, and the good news is that Tirzepatide, Mounjaro, has already been approved to be used in the patients of obstructive sleep apnea. So these are the things what the prescribing doctor need to do, and with the experience and writing more and more prescription, every doctor understands that what better they can do with their own experience to not to do any harm to their patients, and if there is anything happening to either stop that in the beginning or to reverse that complication. The blood work, including your thyroid profile, the HbA1c, serum insulin level, fasting, lipid profile, liver function, kidney function, amylase, lipase, urine protein, very, very important, and if possible, UACR, to be done in the beginning of the, before starting the medication, and if possible, to be repeated every 3 months. Ultrasound to be repeated, if possible, every 6 months. So these are the things what to be done while prescribing these medications to any patient. And when the patient asks for how long I have to take these medications, the answer is very clear. For diabetic people, there is no end limit if the patient is tolerating these medications well. But if for a non-diabetic, overweight, obese people, once you reach to the target, then definitely we will taper down the medication by the dosing, and then we stop that. Then my experiences with my patients, I'm sure I have done more than 300, more than 300. I don't have the number exactly because I've stopped counting them. I have found a phenomenal result, and I'm using this word phenomenal. Why? Because these are our personal experiences in terms of the weight management of our patients. And even in the people, in the patients whom we have stopped the medicine after achieving the target, patients have not, most of the patients have not gained the weight even after 3 to 4 months of stopping the medication. See, please understand that we have been prescribing, and I have no hesitation saying that we have been prescribing the medication even before they were launched because people were in India, because people were in any way availing these medicines from here or there, and they were misusing the medication. So as doctors, it became our responsibility to supervise them. And with that, with the experience of more than 300 plus patients being on Ozempic or Mounjaro, I can say that the complications of, like the way I told, of one patient having the biliary stasis, and we had to remove the gallbladder. There was one episode which has other valid reasons behind that. Otherwise, other than the small acute side effects like gastritis or hyperacidity, constipation, and some patients diarrhea, which are easily manageable by the other medications like any proton pump inhibitor or H2 blocker, or the diarrhea by like something like loperamide, or constipation by fiber or a laxative. Things were easily managed, and people are able to do good and able to manage it. Now for the patients, what patient also, so this is about the doctor side. Now from the patient side, the bigger responsibility is of the patient. Now